Today, the CDC director said his agency is committed to sharing the most up-to-date information on coronavirus, even though that means modifying public health recommendations. With the guidelines changing what seems like almost daily in some issues, we asked how you should know what information to trust and listen to. WAAY 31's Sydney Martin is live outside Huntsville City Hall after asking a local hospital leader about how they manage all those changes.
Dan, today at City Hall, I talked to Dr. Pam Hudson, Crestwood Hospital CEO, about that, and she told me the weekly news conferences that the city of Huntsville has are a great place for people to get those answers. She also told me that if you have any questions or if you're confused about things that you hear, you should consult with your doctor.
I was just listening to the CDC talk a little bit about their somewhat confusing recommendations over the last few weeks, and part of it was driven, as I heard today, by concern that people assumed that if they were tested and it was negative, that they were okay to go to work or school or be out in public.
Crestwood Hospital CEO Dr. Pam Hudson said she knows there's confusion with CDC guidelines when it comes to coronavirus. But she said social distancing, wearing a mask, and sanitizing are the messages health officials have maintained throughout the pandemic.
There really has not been a material change. So I think one of the things that our physicians are well qualified to do is to understand what's nuance, what is interpretation, but the facts and what we do really has not changed materially.
Hudson told me she believes the precautions already in place are working.
It's important to chart our course and stay the course until we're absolutely certain. When somebody puts out a recommendation, ask questions about it, see how it fits into the greater context. We're going to come up with something for this community that's going to work for this community, and it may be more than what the guidance is from ADPH or from CDC, etc. It's what fits for this community to keep this community safe.
And she doesn't believe anything major will change with the local coronavirus response anytime soon.
It's important to chart our course and stay the course until we're absolutely certain. When somebody puts out a recommendation, ask questions about it, see how it fits into the greater context.